Cancer patients are often surprised when the doctor tells them, let's go install a device called a port so you can receive chemotherapy. What is the story behind this device? Unfortunately, in some cases, chemotherapy can cause damage to the veins. Although it's rare, it can happen. Sometimes the chemotherapy leaks out of the vein and causes severe inflammation underneath the skin. Also, sometimes it can be very difficult to insert a cannula to administer chemotherapy sessions, especially if the sessions are frequent or numerous. Therefore, it is recommended that chemotherapy patients have what is called a Portacath device installed so that chemotherapy can be administered through it. It is a round device about the size of a coin or maybe a bit smaller that is placed under the skin and beneath the collarbone. The catheter is connected to the central vein and is inserted through a very simple surgical procedure which takes about 20 minutes or even through interventional radiology. The device remains under the skin and is not visible, but it stays in place and can remain with the patient for a long period of time. It could be in place for months, a year, or even longer, depending on the chemotherapy treatment schedule, and the patient can go about their life completely normally. When it's time for the chemotherapy dose, the patient comes in. This device has a specialized needle that we have at the hospital. We insert the needle into its designated spot, and the patient receives the chemotherapy treatment. After the dose is finished, the tooth is easily removed and the patient rubs it. He's not supposed to feel any pain from it. It's not supposed to bother him, except maybe just a little. These are all the advantages of the device. Of course, it does have some disadvantages, although they are rare or very minor. For example, there could be a problem with it, in which case we might have to remove it or perform a minor intervention. The other thing, and this is more important, is that an infection could occur through it. In this case, we usually have to remove it, and in most cases, perform another surgery and start over. Of course, in most cases, we administer intravenous antibiotics according to the culture results, and the course of antibiotics tends to be long. That's why many doctors do not prefer to install the port in some cases where there is immunodeficiency, especially when the patient will be undergoing chemotherapy for a very long period. However, in most cancer cases, installing the device is preferred. Of course, ultimately, this decision depends on the physician's judgment. Don't forget to subscribe to the channel so you can get all the updates on cancer topics.